2021 has been another challenging year. Ongoing disruptions of the COVID-19 pandemic caused fear and uncertainty for many Australians. But there was always one primary healthcare destination which could be relied upon to be open to meet the needs of their patients: community pharmacy. Community pharmacy has continued to demonstrate its resilience and agility. Its focus has always been on providing genuine care and advice for patients, even more so during these difficult times.
A lot of us were working 14-hour days just to get the paperwork done. We've been so overrun, we've been so worn out. The phones have just been running. It's just been crazy. It's been a really hard time.
In the face of staff shortages, sheer exhaustion and the ongoing pandemic, 5,900 community pharmacies remained open and accessible, always committed and always caring to ensure their communities continue to get the best possible healthcare treatment.
They have helped me incredibly, both physically and mentally. I have no idea how I would have gone through some of the circumstances I've had without them.
In June 2021, the Commonwealth Government asked community pharmacy to step up to help in the fight against COVID-19 and vaccinate the many Australians who wish to be protected. Working in partnership with federal and state governments, community pharmacies dramatically accelerated Australia's COVID-19 vaccination rollout, helping to relieve the anxiety of many Australians by being available around the clock to take bookings, administering over 6 million vaccines, and supporting 3.6 million concessional cardholders by providing access to over 21 million rapid antigen tests, bringing hope for a future that allows us all to live freely again.
Pharmacies have become such an integral part of our vaccine rollout program. These are very stressful times for health professionals, and you've had to deal with a lot of change. But when our country needed you, well, you've answered that call in large numbers.
Lockdowns saw an increase in home delivery services, with Australian pharmacies going above and beyond to deliver medicines and other essential items to ensure sick, vulnerable, or isolating patients could continue to access their medicines. Financial assistance was also offered to some patients to help them pay for medicines.
Some of these home delivery services could be up to a 600-kilometre round trip, but we also ensure that our local community is served here well to ensure that they have their medicines in a timely manner.
Pharmacists are one of the most trusted professions and help guide patients daily through their primary healthcare and medication decisions. The level of trust patients have in their pharmacists means they are also confident to discuss other issues with them. Recently, pharmacists are seeing an increasing number of patients telling them they're finding prescription medicines unaffordable as the PBS co-payment continues to rise. With more than 1 in 5 Australians aged 18 to 64 struggling to fill a prescription, pharmacists are distressed when patients say they have to choose one medicine over another, or which family member gets their medicines. With no real universal access to the PBS, the foundation of our health system, community pharmacists are raising the alarm in support of their patients. Driven by the desire to improve health outcomes holistically for patients, pharmacists want to do more for their community and their health. Currently, pharmacists don't practice to their full university-educated scope. Community pharmacists, guild members, and the broader profession stand ready, willing and able to assist the Australian Government to reduce unnecessary hospitalisations, drive savings across the health system, enhance patient outcomes, and bring us in line with other nations like the UK, New Zealand, and Canada.
On my very worst days this year, all I have had to do is step back and look at my colleagues across the country and really look at the difference that they have made with their community.
In the face of fires, floods, drought, and COVID-19, community pharmacies have always been there, always committed, and always caring to ensure their communities continue to get the best possible healthcare treatment, regardless of the environment they're operating in.